Hello everyone, today's topic is fracture of the spine and pelvis. My name is Lin Chong. I come from the Department of Orthopedics, the first hospital of China Medical University. For today's topic, the first part of the content is spinal and spinal cord injury, and the second part is pelvic and acetabular fractures. The first part, you should master the theory of the three columns of spine, and you also should remember the classification and the treatment principles of spinal fractures. And third part is the pathological classification of spinal cord injury, and the fourth one is the Franco classification and the ASIA functional grade. For the first part, you should remember the three columns theory. The three column theory, which was development by the Dennis in 1983. And you should know which part is belong to the anterior column, and which part is belong to the median column, and which part is belong to the posterior column. And for the second one, you should remember there are three kinds of the classification and treatment principles of spinal fractures. The first one is the classification by injury mechanism, and the second one is the classification according to the fracture stability, and the third one is the classification by fracture methodological. And for this part, you should remember there is a very important key point as the TLIX classification. You should remember the TLIX contains the morphological and the PLC and the neurological status. The patient which was with the TLIX score less than 3 points, maybe the patient only needs the traditional non-surgical treatment. And the patient with the TLIX score more than 4 score, maybe the patient needs the surgical treatment. And for the patient get the TLIX 4 points, maybe both surgical and non-surgical treatment are okay. And for the pathological classification of spinal cord injury, you should remember the difference between spinal shock and spinal cord concussion. And there are several key points of these tables. You should remember the table. It's very important. And also, you should remember the difference between the complete and incomplete spinal cord injury. And for the last one, you should know what is the Franco functional rating. You should remember the Franco functional rating, which was ranged from level A to level E. And the level A is the complete loss of the motor and the cellular function, and the level E is nearly the normal status. And ASIA functional grade also range from level A to level E. The level A is the complete spinal cord injury, and the level B, C, D is the incomplete spinal cord injury. For the level E is the normal status. And for the second part of today's topic, the pelvic and acetabular fractures. You should remember the classification of the pelvis fracture and the first aid treatment of pelvis fracture, and the last one is the classification of acetabular fractures. For the first part, you should remember there are three kinds of the classification of pelvis. The first one is according to the seat and number of fracture, and the second one is the classification by direction of injury and violence. And the third one is a classification by pelvic range stability. And for the first aid treatment of pelvis fracture, you should remember A, B, C, D, E, F. The A is the airway, B is the bleeding, C is the central nervous system, D is the digest, E is excretion, and F is a fracture. Maybe you should remember that the pelvis fracture may become the last. And for the last part of today's topic, you should remember the classification of acetabular fractures. There are single fracture and compound fracture. At the end of today's topic, I'd like to give you one sentence. The needs of patient come first. You should remember what all knowledge you have learned today is best for the treatment of patients in the future. Thank you so much.